So in general, I would say the most common gynecologic cancers that affect our population are going to be cervical cancer, endometrial cancer, and ovarian cancer, but I also deal with vulvar cancers as well as lesser known vaginal cancers, and et cetera. So there are quite a few ways to screen and prevent these cancers. So one of the more common cancers that I see is endometrial cancer. So one of the most common risk factors for endometrial cancer is obesity. So actually just maintaining a healthy lifestyle, making sure that you're getting a lot of physical activity in at least 30 minutes during the day, and eating more cleanly can actually significantly reduce your risk of endometrial cancer. And that's important because there really isn't a screening process for endometrial cancer, for instance, like there is for cervical cancer. So it's important to have a routine gynecology visit, and part of that visit is the PAP and HPV screening, but of course gynecologists are also going to screen for sexually transmitted infections, abnormal bleeding, other issues that might actually trigger a workup for a malignancy. So a lot of women that come to me with abnormal bleeding sought care with their gynecologist first, for instance, and that triggered a biopsy, which might have resulted in a cancer diagnosis. Another key component of those visits is really for the patient to really focus on their family history. So I think it's something that a lot of us kind of put in the background. Okay, well, mom died of breast cancer, but that's kind of in the past, or my grandmother had pancreatic cancer. So it's actually extremely relevant, because if you look at one of our deadliest cancers in GYN oncology, which is ovarian cancer, there really, unfortunately, is not a good screening mechanism for this. But if you look at the data, about 25% of patients who have ovarian cancer will have a genetic mutation that actually led to them getting that cancer. So if we can identify an appropriate family history, those patients can be screened with genetic testing. And if they do find that they have a genetic mutation, we can act on that before that patient is diagnosed with ovarian cancer, and we call that previvorship. So that's very important, that when you do see your doctor, that you really stress all of the family history. Even if it doesn't necessarily seem relevant, it may be for the future.